Hey there, welcome back. And hey, today we are talking about your pet's eyes, and Dr. Jerome Williams, regular here on Good Day Alabama, along with Dr. Jana Korsch-Dismukes to talk about corneal and cataract surgery for our pets. Great to see both of you.
So good to be here.
So good to see you too, Doctor. So when someone comes to brings their pet to you, and you see certain things and you know to refer them to someone like Dr. Korsch, right? Right,
that's what we do, and in the case of Buddy, that's what we're doing, because when there are lesions that need care beyond my expertise, then we got wonderful doctors like Dr. Dismukes.
All right, and he's talking about Buddy, our dog, because Buddy has what you call, I showed her a picture.
An eyelid tumor.
An eyelid tumor, and we've got to have that removed. So we're going to take Buddy in to be taken care of. But specifically, you're talking about cataracts.
Yes.
And corneal
disease and surgery.
All right, do you see that in cats and dogs?
We see it in cats and dogs, more commonly in dogs. Cataracts are very common in a number of breeds. There are, oh gosh, too many breeds to mention really. Boston Terriers, Poodles, Yorkshire Terriers, and some bigger breeds like Siberian Huskies and Labrador Retrievers. They all get hereditary cataracts.
And so you said a lot of times you just notice the cloudiness of the eyes of the pet owner will, right?
Right. They'll either notice that the eyes have a change in appearance. Here's a cat that has cataracts. They're pretty advanced. Obviously those eyes don't look normal. The other thing that owners will notice is a decline in vision. Their ability to navigate around the house declines, and so they'll bring them in because they think they're losing vision. So here's the kitty after surgery.
Wow.
Yes, so much clearer. Now he can see, and he actually has intraocular lens implants in both eyes.
Oh my goodness, that's pretty serious there.
Profound, yes. So you're taking the old cataract lens out and replace them with
an artificial lens implant that's acrylic. Yes, so it's the same procedure that's performed in people. It's called phacoemulsification, where we liquefy or use ultrasonic destruction of the cataract and aspirate or suction it out of the eye, and then we can place the artificial lens implant.
That is amazing. All right, you have a picture of a dog as well. Let's look at the before.
That's a little Pomeranian that has an acute onset of corneal disease, something called bullous keratopathy, where fluid or basically like blisters have formed on the surface of her eyes.
Yeah, let's talk about this for a moment. I know a lot of times dogs' eyes look different when a picture's taken care of, but we're really seeing I mean, that's not just a weird thing from a picture.
Right, so you can see the bottom part of each eye has a blister. It's been stained with something called fluorescein stain, but it's almost like a melting process of the cornea.
And then look at him afterwards.
There she is after bilateral corneal grafting.
So you have to take the old diseased cornea off, remove it?
We cut that out, and then we use adjacent healthy tissue to graft, almost like a skin graft, but a tissue graft over that defect.
Now, are all? I mean, was every pet a candidate, or is it like a person? It varies with different patients.
That's a good question. Every pet is a potential candidate, but would have to be evaluated to see, if they're a good candidate for cataract surgery, and sometimes other health factors, play a part as well.
Has cataract surgery in pets become? It's really commonplace for humans.
Yes.
After so many years.
Yes.
Is it? Oh, hello. Is it becoming that, or is it the same? Commonplace?
It is pretty common. It's not as common, I guess, as in people, but it's becoming more common, and because the procedures have been perfected, the success rate's higher, and more people are educated about it and are opting for that for their pets.
And with 12 to 15 years, the average age, and cataracts begin to occur at 9, 10, 11 years of age?
Right, so the senile cataracts do start later in life, and with better health care, we see longer lived pets, and so more cataract development, in addition to those juvenile cataracts that happen in the young dogs.
All right, tell our folks where you're located.
I work at Riverview Animal Clinic on 280.
Okay. So if you're interested there, we'll have a contact at myfoxal.com, and you can always call Dr. Williams.
Absolutely.
Red Mountain Animal Clinic. Good to see you both.
Thank you.
Always good to be here.
You too.
Thank you.
All right, let's check in now on our weather conditions.